One study revealing nearly 3,700 kids ages 12 to 18 have received trans-related surgeries in a 4-year span. Dr. She's a member of that group and joins us now. Doctor, welcome to you. First up, why now have plastic surgeons decided to urge against surgeries for trans youth?
The American Society of Plastic Surgery put out a statement last year. They just updated the statement this year to put the 19-year-old age limit. And it's based on 12 to 14-year data out of Europe, actually. Many very progressive-leaning political countries in Europe, like England, Sweden, and Finland, have already stopped doing these procedures based on the long-term data. And I can tell you that they're just coming back to common sense, coming back to science, not being ideology-driven, and really looking at, the evidence. And their statement says that the benefits do not outweigh the harms, and the current evidence is low quality or poor quality. These are kids we're talking about. Many of us have been very loud on this issue, and I'm so happy to see that the American Society of Plastic Surgeons is doubling down on their statement from last year.
I appreciate it, Doctor. Meanwhile, there are so many detransitioner lawsuits out there. At least 25 cases we know of have been filed since 2022. This was a testifying in a gender surgery malpractice suit saying, quote, "I was 16 and I was really, really mentally ill. I obviously wasn't mature enough to make the decision to have surgery. And I certainly wasn't mature enough to handle the aftermath." To fathom there were so many doctors that let this go on.
Great question. In the beginning, I actually thought they were doing the right thing. And the European data came out, and I approached one and I said, what about all this long-term data coming out of Europe? He said, what long-term data coming out of Europe? And at that point, I realized this is ideology-driven. It is money-driven. Hospital systems and physicians that do these surgeries have made a lot of money. And again, this should not be how we treat our patients, and especially not children.
What about the overall environment for this? It seems like the tide has certainly changed. Political pressure to look at this from the current administration. But has that made all the difference, or is this just time?
Not. I really think it's the long-term evidence that has come out, mainly out of Europe, that is leading plastic surgeons to say, we are doctors first. How is this any different than research done on blood pressure medication or diabetes medication? This is a medical procedure, and it should be evidence-based driven, not ideology-driven or what makes you feel like a morally superior person. Everything has to be done with evidence. It is a surgical, permanent, life-altering procedure.
What did have the procedure, who obviously are in a mental struggle now, to see that they were advised wrong?
30 to 60%, based on what study you look at, of these children had a concurrent mental, behavioral diagnosis, like autism, like depression, like anxiety. And these doctors and psychologists told their parents, you can either have a transgender child or a dead child. And that is emotional blackmail, and there's no evidence showing that these procedures actually decrease suicidality. So they were lied to. They were not given informed consent. And based off of that, I really think that they have a lawsuit, and I hope that this isn't the first lawsuit.
आगे जाके बैठ के बना लेना, तेरे को बना है। अरे स्मायो उधर आके जाके बना लेना। ले तो बना लेना।